Vanakkam. Welcome to this course on classics in neuroscience. We have been looking at the neurological foundations for brain imaging or neuroimaging. We looked at the seminal work of Stanley Cobb, Derek Denny Brown, Raymond Adams and Miller-Fisher. In this video, we will continue our discussion of how neurology or neurological foundations led to the development of brain imaging. In particular, in this video, we will look at the work that started or that was pursued at the Montreal Neurological Institute, in particular the work led by the legendary Wilder Penfield. And his colleagues and his students and his trainees, and how this led to an important milestone. His works led to critical milestones in the development of the field of neurology in general, in particular neurosurgery. So, one of the crucial contributors to the development of neurology and neurosurgery was the neurosurgeon Wilder Penfield. Penfield trained with Sherrington in Oxford, Gordon Holmes in Queen Square. He also trained with Santiago Ramon y Cajal in Madrid and also with Ottfried Forster in Breslau in Germany. So, even for those times, this can be considered to be a very distinguished pedigree. So, he came from some of the best known labs in the world at that time. So, a very distinguished pedigree. He was looking to start a neurology program or a neurology department or a neurosurgery program or a neurosurgery department in the New World, in the Americas, that is either in the United States or in Canada. He was looking for that. So, Alan Gregg at Rockefeller Foundation was instrumental in encouraging him to start a neurological institute, and through another acquaintance, Edward Archibald, he settled on starting this department or the institute at McGill University in Montreal. So, he essentially established or practically founded the Montreal Neurological Institute at McGill University in 1934, and it became one of the foremost centers of learning in the field of neurology and neurosurgery anywhere in the world. It is still a prestigious institute anywhere in the world in the field of neurology and neurosurgery. Even today, the Montreal Neurological Institute continues to be a forerunner in this field. So, Wilder Penfield studied what most other neurosurgeons and neurologists at that time studied, that was epilepsy. So, we discussed in the previous set of videos how before the advent of EEG, neurologists practically had no way in which they could treat the patient. Neurology essentially involved noting down and collecting and synthesizing symptoms. As such, there was no way to provide therapy at that time, which is why neuropsychiatry, neuropsychiatry took a front seat in this field when compared with neurology itself. The major problem or the major disease of the day was epilepsy, and there was practically no simple and objective tool to diagnose epilepsy before EEG. And with the development of EEG in the 1920s, late 1920s, EEG became the primary tool in the hands of the neurologists and was used to identify abnormal activation in the brain, and then that was used to localize the misbehaving neurons, so to speak, or those neurons that were misfiring or that was causing this patterns of discharge. Then it was practically the solution was to remove these neurons, these nuclei. That was the surgery. That is still the surgery, except that the localization methods have improved a lot in the last 6-7 decades or 10 decades nearly. But the solution was to remove these nuclei or these centers that were discharging in an abnormal manner. That was the solution. So, Wilder-Penfield essentially developed protocols that involved neurological, psychological and EEG studies. So, you need to do some work before you take the knife. These protocols were first developed by Wilder-Penfield and his team in Montreal in Canada. So, this workup, this detailed workup was first developed, and of course, this is a work in progress. This was very well developed much later, but the first one to come up with this neurological, psychological and EEG based studies on patients of epilepsy was first started in the Montreal Neurological Institute by Wilder-Penfield. Also, he performed the famous cortical stimulation studies on conscious patients to support the idea of localization of brain function. This was a pioneering contribution. Of course, we would have seen the papers. For example, you can check this open access paper, A Little Man of some importance, published in the journal. The name of the journal is Brain, Oxford University Press. Please do Google this. It will summarize the contributions of Wilder-Penfield in his identifying the sensory and the motor homunculus. See, what you see here is the motor homunculus. You see the huge hand, and also in the sensory homunculus, huge hand. The representation or a disproportionate representation of the head and face and hand when compared with the rest of the body is what Wilder-Penfield found, which he represented, which he called as a little man, and this came to be called as a homunculus. You can check out the review paper in the journal Brain that describes what exactly was the work and what was its interpretation and what is its current status. Like, it is not that it is completely ignored, nor is it that it is super important. It is a little man of some importance. Do check that out. And of course, he continued to perform other studies also, electrocorticography and other neuropathological studies to improve our understanding of epilepsy itself, the neuropathology, the neurophysiology or the pathophysiology of epilepsy itself. He studied using electrocorticography. Of course, he collaborated with Herbert Jasper, who performed EEG studies before, during and after surgery. So, this kind of studies, pre-post studies or pre, during and post type of EEG studies to compare activation levels before and after surgery with Herbert Jasper. Remember, Herbert Jasper is one of these pioneers who went on to become a pioneering leader in the field of microstimulation. His contribution towards understanding our motor function. Herbert Jasper is a famous pioneer in the field of microstimulation. Of course, in our previous weeks, we have seen how Ramonica Hall characterized different types of glial cells, neuroglial cells, and also how the homunculus in humans was identified. This is also something that we have seen in the previous week, for example, in chapter 10, that is week 5. Also, how Brenda Milner, the psychologist who studied patient HM, was essentially a trainee of Wilder Penfield. Something to keep in mind, the kind of rigorous training that was provided by, or that was afforded by the Montreal Neurological Institute went on to help Brenda Milner do her life work on patient HM. Of course, it is amazing to think how an ordinary person or a person who is considered otherwise normal could be so extraordinary in so many different dimensions. Because Wilder Penfield was mostly a very normal person, or a person who led a normal life and had a normal personality, in contrast to the all-consuming passion and drive and forceful methods of others, for example Harvey Cushing and others. Wilder Penfield was famous for his mild manners and his well-grounded approach. So much so that one of his colleagues mentions that Penfield always struck me as somewhat of a saintly person. This went beyond his Bible reading on Sunday evenings. He was a thoughtful and kindly person in his relations with his patients and colleagues. At the same time, his critical mind demanded the best of himself and his staff in both his research and in the operation of his institute. So, it is really amazing how an otherwise ordinary person could be extraordinary in so many different dimensions. Of course, there are others like Penfield, one of whom was William Lennox. Of course, some ethical concerns about his research methodology continue to remain. For example, he performed this experiments, electrocardiography and other experiments that led to the development of these homunculus, both motor and sensory homunculus, in patients who were presented to him with epilepsy. Would such methods be admissible in today's world? With today's ethical committees, would they approve such research? So, open question, likely not. My answer with my experience is that today's ethics committees will not approve such experiments on patients. So, there are some ethical concerns about this kind of research. Besides, patients of surgery, whenever they come, keeping the part of the body open for longer than needed, keeping the skull open for longer than needed for experiments is a dangerous idea, because there is no such room as a sterile room. No matter how sterile the room is, there is always an increased possibility of infection. So, if the surgery continues for a long time, there is an increased probability of infection. So, that means that the good surgeon, it is said, for example, is the surgeon who comes late and leaves early, or in other words, is the surgeon whose arrival and departure happens in a flash. That is, they open, they do the job and they leave. The amount of time that the inside of the body, any part, this is for any part, remains exposed, as it increases, the skill of the surgeon is being questioned. This is true in surgery. Students of surgery will be able to appreciate what I am saying. Good surgeon is someone who performs that surgery in the quickest of time, because the probability of infection reduces. This is true in today's world. This is true even today. So, these questions about performing research on patients who came for a different purpose are not considered ethical as per today's ethical standards, but it is not fair exactly to hold research that was done in the pre-Second World War era to the standards that we have today. That is also not fair. So, questions remain. So, there is no definite answer. I cannot say that Wilder Penfield and his experiments are unethical as per my ethical standards, because my ethical standard is the standard that I hold today, right. These standards themselves evolved and were practically invented after the Second World War, after the disturbing use of Jewish people as experimental participants by the Nazis without the consent of those participants. Only after that the idea of informed consent and other such ethical procedures came. That was after the war. Much of the experiments were performed by Wilder Penfield and his team before the Second World War. So, something to keep in mind, is an ethical dilemma. There is no definite answer, there is no yes or no, there is no right or wrong, just leaving the question open, but something to keep in mind. To read up the paper, A Little Man of Some Importance, do Google it up. I will also ask my teaching assistants to share the link of the paper in the forum. With this, we come to the end of this video. In this video, we looked at the establishment of the Montreal Neurological Institute and the seminal contributions of Wilder Penfield to the field of neurology and neurosurgery. Thank you for your attention.